Welcome to Craving More, a CrossFit Crave podcast where we find motivation through obstacles, resistance, and everyday life. This week on the podcast, we gladly welcome Dr. Tyler Lomnicki from Minster Chiropractic. Dr. Tyler has been in practice since 2014 after graduating from the National University of Health Sciences near his hometown of Chicago, Illinois. He is a board-certified chiropractic orthopedist, achieving diplomate status from the Academy of Chiropractic Orthopedists in 2016. As a board member of the International Academy of Neuromusculoskeletal Medicine, he helps create the clinical examination material for doctors certifying as chiropractic orthopedists. He has completed multiple continuing education courses in motion palpation, is certified in McKenzie diagnosis and treatment, active release technique, and kinesiotaping. Dr. Tyler is a certified Cox Technic practitioner. Most recently, he's certified as a functional mobility specialist and functional range release provider through the functional anatomy seminars. He lives in Minster, Ohio with his wife and 2 daughters. He practices with his wife and father-in-law at Minster Chiropractic Center. So without further ado, please join us for this amazing conversation with Dr. Tyler Lomnicki.
Welcome back, CJ.
Matt.
How are you?
I'm great. How are you?
Good. We have a super special guest.
Very special guest.
Dr. Tyler. What's going on? Tyler's listened to our nonsense for the last 30 minutes. He's like, you're on the clock. It's time to let's get this started.
I'm a doctor. I got stuff to do.
I don't.
At least not today.
Not today.
Not today. We have our desk. Here we still don't have more desk. What do you call this down here that we have?
Table
decor. Table decor. The cool thing about it
Works.
Yeah, that works. The cool thing about it, we have this table decor. It says "Work hard, be nice," with a picture of Mo Dingo, who is actually in the house this afternoon, helping us with our podcast, which is super cool. That's why it's been setting out from the beginning, right? Super cool.
Super cool.
All right. So, Dr. Tyler.
Yeah.
We asked you to kind of come on the podcast as we kind of venture into what we feel CrossFit Crave's new direction is. And I want to say new direction, but the direction we really want to push for from a kind of health and wellness perspective.
Absolutely.
We see CrossFit as a great way to exercise and become better for tomorrow, right? But we've incorporated some things most recently last year with Maria Zenz in physical therapy. She has an office at your facility, and she has a kind of a satellite office here, if you will. We've interviewed her. We've interviewed Dr. Libby Wilson on the podcast, who is kind of changing her family practice, doing now all functional medicine. And our goal, at least I think from our perspective, is to see, hey, what other facets of health and wellness do we need to bring in, or at least have available to help people live better?
Right.
Not high professional athletes. That's not what we're going for. We're going for moms and dads and grandmas and grandpas and aunts and uncles to be able to pick up their kids tomorrow. And I honestly feel chiropractic is a huge part of that. That perspective.
Absolutely. I think it fills a gap in a lot of those. It doesn't have to be professional athletes, like you said.
Right. Pick
up your kids, give them a bath, those types of things, getting them in and out of the car.
That's right.
Groceries out of the trunk, that type of stuff. Functional.
That's right. Functional.
Yeah.
And you hit it. Getting groceries out of the trunk of the car, right? If you go to a doctor, they may say, "Hey, don't deadlift or don't do any back squatting." Okay, never pick anything up.
Good luck living your life.
Yeah, it's like it's over for you.
Right.
Right. So we're excited to have you on to at least maybe start that conversation, and I'm sure we'll have you on again as we expand into different.
Yeah, if we don't run out of stuff to talk about today.
Yeah. Why don't you? That's right. Why don't you tell us a little bit about yourself, maybe your background, where you're from? And...
So I'm originally from the western suburbs of Chicago. I grew up in a town called Elmhurst, which is like 20 minutes west of the city.
So I got to ask.
Yeah.
Who do you root for?
Baseball-wise?
Baseball.
I'm a Cubs fan.
Cubs fan.
I'm a Cubs fan. Yeah.
All right.
There was like a time, I think, when I was like 4 where I wanted to wear a Sox hat.
Yeah.
And Dad didn't let me.
Because there's a dividing line,
yeah,
right?
Yeah, the people that say they're like fans of both
No.
might not even be
Fake
from
person.
Chicago. Yeah,
That's
catch
right.
up on their hot dog. Yeah. So I grew up in the western suburbs of Chicago, and I was able to stay in that area to do my undergraduate program at Elmhurst College, and then chiropractic school is a town over. So in chiropractic school is where I actually met my wife, Sunny.
Cool.
And when we graduated and got married, not in that order. Actually, we got married like 4 days before we graduated.
Nice.
Yeah, it was a weird month. We moved back to Minster, where she's from, to practice with her father, my father-in-law Kurt, at Minster Chiropractic Center. So, we've been back here for 6 years now, I think.
Awesome.
So, end of 2013 is when.
Nice. Cool. And you have a couple of children,
We have
right?
2 kids. I've got 2 daughters, 4 and a 1-year-old, Drea and Luca.
Yeah.
And
Super cool.
6 years go by quick. Like the last 4 years are a blur.
Yeah.
I have no idea what's going on.
Yeah.
Kids do that.
Trust me, it gets worse.
Yeah.
As they get older.
Patient. Yeah.
Right? That's right.
Yeah.
Super cool. So why chiropractic school?
Yeah. So growing up, somewhat athletic. I've got 2 brothers. I've got an older brother and a younger brother. I'm the middle child. My older brother, I think how it all started, because we never grew up going to a chiropractor.
Yeah.
Older brother had, I think, some minor injury that a local chiropractor started working on and fixed quickly. And then from then on, I was like, anytime you guys are hurt, go see Doc. And growing up in that, once we were in athletics and seeing the ability of somebody like that, even though, maybe not the first person you'd think of for sports injuries, at least when you don't have an understanding of it. I ended up working for him when I was in high school, just little stuff around the office. And then when I went to my undergraduate, I still wasn't sure, just like no one is when they go to college.
Yeah.
But by my sophomore year, I decided it was something that I wanted to maybe pursue. So I ended up getting my exercise physiology as a major and parlayed that into chiropractic school. So it was something I kind of decided midway through college.
Yeah. That's cool.
Yeah.
CJ, that's what you just graduated with, right?
Yeah.
Exercise physiology.
Yeah, I've been shadowing
Yeah.
Dr. Tyler.
Yeah. And I've
Dr.
been a patient. I've been a patient of Dr. Tyler's. So it's cool.
Super cool.
Yeah,
Say
that's
Dr.
right.
Tyler or Dr. Lomnicki?
Oh.
We usually just, around here, it's not a German last name, so I never use Lomnicki. I get, that's the joke around the office is you're not from around here. So
Yeah.
Dr. Tyler's fine. Dr. Tyler. Or just Tyler. You really don't have to put doctor. We go by our first names in the office.
Yeah.
Yeah.
The transition from you finish schooling and then what? I know you've kind of talked about this and from, hey, what do I do now? How do I go continued education? And so you figured that out. You went to chiropractic school. You met Sonny. Your father-in-law, and I'm sure you knew this at the time, huge practice in Minster, probably one of the most well-known chiropractors in the state, if not at least this area, from a name. You're like, okay, everyone knows that name when it comes to chiropractic. How do you make a decision? Like, what are we going to do?
Right.
We graduated, we've got these degrees, now what?
So that's interesting because when Sonny and I started dating, and we got engaged, and we knew we were going to be practicing together in some way, shape, or form, but it wasn't decided that we'd be back in this area. We had actually, looked at the West Coast. Both of us like the Arizona area. I've got extended family in Tucson, and so we were looking at Southwest. She ended up, after running and graduating from Notre Dame, she ended up having a couple of years eligibility, and she ran it as a state. And so she fell in love with that area. She found a chiropractor there that she really liked, and she just loved the desert, that area. And so we were looking all over to try to decide where are we going to go. And then we actually, the way that this all worked was we had been in discussions with a real estate agent to open a practice in a town over from where I grew up, to stay in Chicago. And the night that we were like ready to sign the papers, we both got cold feet. Like couldn't do it. When you're in chiropractic school, you're always looking at, I'm $250,000 a day.
Right.
How am I going to start making a living?
What do I do?
What I mean? What do I do? And so my father-in-law had always floated the idea. He originally started the practice, and then a few years later, his younger brother joined the practice. So his younger brother, Keith, was in the practice for a really long time. And then Keith kind of just wanted a change of scenery. So he ended up moving to Chicago while Sonny and I were in chiropractic school.
Okay.
And so Kurt was kind of on his own. And I always joke he looked like a president 2 terms, like during a really bad war. Like he went from, he was gray by the time we moved back because he was just working the whole office by himself.
Yeah.
And not that he couldn't handle it, but you could tell. Like it would have been nice to get Sonny back home and have some help. And so Sonny was our valedictorian. But I always joke that I was the smartest kid in the class because if you can convince the valedictorian to marry you, and then not only that, but get her dad to give you a job right away. Like, you know what I mean? So
that's one up.
It was it was a really easy decision. Once we like I said, that night, cold feet. She called her dad, and we were like both crying in the car. Like, can we come back and help you? Yeah. So from there it just snowballed, and like I said, we got married 4 days before we graduated. And then we went on our honeymoon after we graduated. And then like a couple days later, we packed a U-Haul and came up. So,
wow.
It was great to enter into a practice that's already, like you said, thriving.
Yeah.
Not only that, but to all of a sudden join a practice and be related to the doctor that started that and have his vision and have his expertise and have his years of experience behind you the entire time. Like he jokes all the time. When we first started, we would call, like he'd be out of the office, Sonny and I'd be in. We'd call him like every patient. Like, what do I do for this one? What do I do for that? Yeah. And so the calls stopped coming, and you feed off of his experience,
knowledge, and background.
Absolutely. Yep. So it was like an extended internship.
Yeah.
Yeah.
Well, we'll dive into kind of what chiropractic, the realm of chiropractic does for athletes in a second, but you guys do something that's not, I say not normal, it's a different type of I know when I came over and you treated me, I'm used to, I need my neck cracked, like grab it, let it rip, right? But at that point in time, was fresh out of surgery. I couldn't, literally fresh, I was like a week, 4 days maybe.
Yeah, you showed me pictures of like the incision.
4 days after surgery. And I was just stiff. And he's like, hey, we're not going to manually manipulate you that way. Right. We do things different here. Yeah. And we couldn't do it all then because I couldn't lay flat on my back or on my stomach.
For you to get comfortable.
Yeah. What do you guys do that's kind of different?
So CJ shadowed me in the office a few weeks back, and he kind of got to see how we do treatment for certain issues. And so one of the things that we utilize is a low force chiropractic manipulation. It's a decompression type technique called Cox technique. My father-in-law started using that technique maybe 15 years ago or more at this point. And it's really been able to broaden the scope of things that we can treat and even the ages that we can treat. So while we use traditional chiropractic manipulation in a lot of situations, we choose to use that technique for some of the more complicated cases. We end up seeing, because we can use that technique in those tables, we end up seeing a lot more complicated disc herniation cases, radiculopathy cases. Yeah. And we get to treat a lot of spinal stenosis issues, which allows us to expand our ability to treat an older population. So, in our office, I think a vast majority of patients are into their 6th, 7th, 8th decade. And I have patients in their 90s.
Oh, no kidding.
So we can treat those things safely and effectively. And it's one of those things where, just like any occupation, the more tools you have, the better you can treat things and fix things. And so Kurt started using that 15 years ago. And when Sonny and I were in chiropractic school, he pushed us to become certified in the technique. And he's actually a full-time instructor for Cox technique now. Cool. So he teaches every couple of weekends. Most recently he was out like 6 weekends at the end of the year because he's just got really busy with it. Yeah. And he's had the opportunity to teach even overseas, present at spine conferences and things like that. So he really loves that part of it. And it's a huge part of our office. Like you said, when you came in, a lot of patients realize when they walk into our doors, this isn't maybe what they're used to. Yeah. Good or bad.
Yeah.
So there's many different techniques. Because I first thought, like, in high school and stuff, before I heard more about chiropractic, that everyone used the same thing. Like, you're going to get your back cracked or something, and it's going to make everything feel good.
Mm-hmm.
Yeah.
What is that back cracking, though?
So,
great question.
That is a good question. Yeah. So, in all honesty, we still don't really know how a chiropractic adjustment works, or at least the intricacies of the science behind it. So, the cavitation that occurs, or that gas, it's basically a gas release. Synovial tissues release a gas when they reach their end range. And so just like when you crack your knuckles, you know, it's just that release of that gas. What we're aiming for when it comes to a chiropractic adjustment is just to basically apply movement to a stuck or irritated joint space. Right? So chiropractic, I guess, in its beginning, like the original theory of chiropractic had to do with subluxation-based theory, meaning...
Was that the Palmer guy?
Yeah. So it was rooted in the idea that a lot of the dysfunction, whether it's spinal or non, and even some disease processes in the body, are due to changes in the spinal alignment or something of that nature. And so I think that breeds a little bit misunderstanding of what's actually going on in the body. Those types of theories have been thought in many cases to be kind of outdated. What we actually learned here in the last 10 years is that when we adjust the spine in those ways, it actually affects more the descending inhibitory pain mechanism and changes the neural plasticity of the brain. There's a lot of research in the last 20 years into pain and the mechanism of it, the process of it, and how we perceive different things in our body. And so we're learning more. Like I said, we don't really know completely, and that's where different techniques come from. I think straight chiropractic technique is adjust head to toe and try to move as much as you can. But I think there's been a movement chiropractically to bring us more mainstream, more into the integrated healthcare model. And so what we know from some of the literature and the research is that while spinal alignment or fixations or subluxation might not be the case, and that's not to say that those adjustments don't help people, because they absolutely do. But if statistically the bulk of, or the majority of lower back pain tends to be more of a discogenic source, discs aging or bulging or degenerative changes, then if all we're geared towards is affecting those facet joints that will cavitate, you might not be seeing good patient outcomes. And that's why we use some other techniques.
Right. So is that like the root of the problem might be higher in the spine than, or like, so you don't...
I think so, yeah.
Like not just where the pain is?
Right. What we understand of how pain works, for example, you get in a car accident, you have like a whiplash syndrome going on. You strain muscle tissue, ligamentous tissue, facet capsules, whatever it is. You have pain. Okay. There's a difference between acute pain and chronic pain. Acute pain at the onset of injury, the tissues and the nociceptors release chemicals. Okay, bradykinins, prostaglandins, serotonin, and so that's the inflammatory process. And basically, what happens is the nociceptors fire into the spinal cord, and then directly or indirectly through an interneuron, they project up to the thalamus, part of the brain, and then from there to higher pain centers, and that's the experience of pain. Okay.
So that's the, that hurt.
Right.
Like what just happened? Instant.
Yeah, instant.
Right.
Yeah.
The transition to chronic pain involves a central sensitization of the nervous system. So this is weeks after an initial injury. So like you said, we were chasing different areas of the body to try to treat pain. I think you guys talked to Maria about fibromyalgia cases or something like that, where everything starts to hurt.
Yeah. Like I hurt everywhere. Yeah.
And so chronic pain syndromes are a reduced threshold or a reduction in the threshold for that nociception. So the central nervous system basically lowers its pain threshold. And so things that are non-painful, like movement or touch or shouldn't be painful, we call that mechanical allodynia, things that should be non-painful, causing pain.
That are painful.
Basically what's happened is nociception is so upregulated in those tissues and then at the level of the spinal cord and brain where now everything's painful. And so, like I said, with more recent research chiropractically, we're able actually to affect that descending inhibitory pain mechanism. And so what actually happens with an adjustment is we're affecting the body neurologically more than anything else. Okay.
Yeah, and that kind of plays into what we see from an experience here at CrossFit or any location where you're going to go to work out. You hit it when you said that mechanical pain portion. If there's range of movement or a range of motion, like in an air squat, that you have pain in a certain area, let's say it's in your lower back or your hip, that's not normal.
No, it shouldn't be.
Right? And so that's when reaching out to somebody with a background like yourself can help us work on that athlete, right? And that's the tie I think that's missing in maybe not necessarily the CrossFit world, because I think we've done a nice job of trying to venture out, not just us, just CrossFit in general. It's done a nice job of reaching out and talking to experts in the field like yourself. But if, let's say I'm going to a 24-hour gym, they don't have that experience. I don't think they don't have that mindset of, oh, I've got a problem in my hip. What do I do? Well, I just work harder
you have to,
or lay off.
It, you know?
Yeah.
You don't, like, in CrossFit, you have someone or a coach or anything that's just like, hey, no, that's not normal. Like, go here. But if you're on your own, you have no one to, like, direct you or no one to, like, your friend just tells you, like, oh, yeah, you're 40 years old. You can't squat.
Right.
Like,
Absolutely.
that's normal.
Yeah. And you probably see it in your practice. This is a question from an aging perspective. Do you see as individuals age, I'm 45, I can feel it now, but as I get into 60 and then 70 and 80, if I don't have that structure from a range of motion and strength to keep that's when the chiropractic part of it, it's really probably difficult to fix once it's beyond a certain point.
Yeah, like we talked about, chronic pain mechanisms are hard to change, and so if anatomically things are deteriorating, which they should, that's normal aging. When we use terms like degenerative disc disease, it's just normal aging. Arthritis is normal aging to a certain extent. Some of us suffer from genetic predispositions to those changes, and some people need a hip replacement at 35, which is unfortunate, but generally when tissues age, we need to be able to work towards not necessarily modifying movement, but continuing to maintain the range of motion that we have. Because what ends up happening more often than not, and this goes kind of into just a general definition of health, when we stop using motion is when we lose the ability to attain that motion. So
if you don't use it, you lose it.
Pretty much, basically. And so, it's important not only to stay active through our entire lives. Like when you look at the difference between Western Hemisphere cultures and some of the Eastern cultures, like there's like 70,000 people in Japan that are over 100.
Yeah.
And they move better than like our 80-year-olds. Like there's something that we're doing wrong, whether it's activity level or lifestyle, whether it's, maybe there's some genetic play, but, training in a way, if you stop deadlifting, like you said, that patient that you go to your doctor, you say you can't do that anymore. You're not going to be able to do that again.
That's right.
You can make your way back to that, but what are you losing in terms of range of motion at that point? And so maintaining those ranges as we move. And I think that has to do with, if a patient comes in, let's say, for example, a patient comes into my office, I've never seen them before, and they've got groin pain, and they're worried that their hip needs replaced, and they wonder why that happened. Why isn't it happening on the other side? And it's not necessarily like we used it too much, but did you do something to maintain your articular, health and range of motion through your life? Because we all go to dentists for teeth cleaning, and we all go to whatever other doctor to maintain, high blood pressure. So why are we not seeing manual therapists, physical therapists, chiropractors, massage therapists to maintain our bodies?
Great question.
And to add to that is why, along with that help, why wouldn't you add some type of a physical regimen daily, a workout at some level? Maybe it's just setting up off the couch and that's your level that day. Why aren't we incorporating that? Or why? And I think that's what we'll get into in a second, where you want to kind of take your practice from, hey, let's not just treat, let's fix long term. And that means once you leave the office, okay, we've got some follow-up things to do, whether that's bracing or breathing or getting in some type of a physical exercise regimen that helps you long term.
Absolutely.
It's not just a Band-Aid, it's a lifestyle change.
And so for a long time, we've been giving home exercise. Everybody gives home exercises, but what's the follow up on that? Is it achievable to do it every day? Is it I'm only going to do these when I'm in pain, or do we have to change the mindset of the population and say, if you brush your teeth, why are you not
Right.
Doing range of motion exercises. Why are you not squatting a little bit? Using your body weight in certain movements. Because if all you do is the bare minimum through the day, things will catch up to you.
Yeah.
I think we all experience that.
Your bad breath is worse to you than not being able to move or not being able to like walk, without your knee hurting or something.
It's a public health issue.
Right.
More than anything else. I think there just needs to be better education on it.
Education, and you hit it right.
Yeah.
It's just like eating, right? What is available today from U.S. standards of proper eating is awful.
Yeah. Pizza's a vegetable.
Yeah, that's right. Right. That's just not right.
Yeah. So that's actually a good conversation to get into, is what like our standard of health these days. Okay, so through some of my certifications and some of the continuing education stuff, built kind of an understanding of what health generally is. So if we look at, you guys talked about epigenetics with Dr. Louis Wilson.
Yep.
So if we look at our genetic makeup,
Yep.
right, we haven't, according to the literature, the research, we haven't really changed genome-wise for 84,000-ish generations, right?
Yeah.
So for the majority of our existence, we've been hunter-gatherers, okay?
That's
So
right.
if for 84,000 generations we survived that way, and then 350 generations ago, agricultural revolution, right? After that, industrial revolution, and then after that, tech revolution. So if our genetics are telling us you need to move a certain way, you need to eat a certain way for the majority of our existence, and now in the last 200-300 years, we've changed that dramatically. We don't move. If we don't eat the way we're supposed to, and we don't move the way or as much as we're supposed to, then we get our Western Hemisphere picture of health: high blood pressure medications. I'm on a statin now. I'm borderline diabetic.
Yeah.
Those things happen. I wake up stiff every day. Not that those things aren't sometimes normal, but that's what ends up happening.
Obesity.
So I had two things, I guess, of the epigenetics thing.
Yeah.
I heard on one podcast, and it said that we're supposed to be able, not supposed to be able to, whatever, we can walk like 60,000 steps a day, or that was like average, and now we're like, most people don't even get 5,000.
Well, you think about how, we're postulating a lot, but how we used to live, things like diet, things like movement, we probably were trekking long distances for food or for shelter or whatever it ended up being, or you were getting chased by something you didn't want to get chased by.
That's right.
And so, when it comes to food sources, like if it wasn't back then, like if you don't have the ability to eat what was back then, like why are we thinking that putting other stuff in our bodies is going to
mess you up,
have some negative effect?
Yeah.
So it all goes towards that. Like if we have the ability to walk that much, now we're sitting in a desk all day.
It's going to affect you.
Yeah. Right. And in its very simplest form, we talk about this when we review how to squat properly. And our range of motion is full range of motion. We want you to be able to hit your butt to your ankles, right? We want you to go through that full range of motion. And most people on the onset, so I just can't get there. So we take that back. Well, remember, most of our clients have kids, right?
Absolutely.
Like, remember when your kids first started walking? They had those really skinny, flat-soled shoes, and they played with their butt pressed deeply against their ankles, and they bounced around, right? Well, as we age, to your point, we start sitting in chairs and recliners, and we start sitting behind a desk, working behind and that heel cord shortens, and all of a sudden now we don't have that ability to squat when we were given it a God-given ability to get there.
Right.
So your point of 84,000 years of the way we were meant to be processed stopped.
Right. Yeah. What do you think is going to happen?
When
you I have 2 little kids, and so I have this conversation with patients all the time. Like you said, if you feel like you've lost that range of motion, well, is it an anatomical change? Sometimes there's deterioration of tissue. There's anatomical variants that can
broke
cause
my leg or ankle or right.
But for anybody that's ever changed a diaper, unless there's a congenital deformity with a hip issue, most babies can do the splits.
That's right.
Like you could throw their legs to the side; they've got no problem with it. They'll look up at you, and giggle. Right.
That's right.
For instance, if my daughter, she's 4. Probably still do the splits. I haven't checked.
Yeah.
If she, and I sure as heck hope she does, want to dance because we bought all the crap for her to dance.
That's right. You're dancing.
Yeah, you're dancing. If she goes through dance and she works on that motion, the splits, okay, she maintains that range of motion, and then she wants to do dance through high school, whatever it ends up being. She does it in college, she does ballet dance, whatever it ends up being, and then she does it professionally. Opens her up her own clinic, wants to be a teacher of dance. Guess what my 65, 70-year-old daughter can still probably do?
Yeah.
Because she's used that. And so that's maybe an oversimplification of the scenario, but that's true. Right. I mean, if you don't work at it, you're going to lose those abilities and those ranges.
Yep.
And then it starts to settle in. Why does every high school boy have tight hamstrings?
Yeah.
You know what I mean?
Yeah.
Like, are you working on it?
Yeah.
No,
they're not.
You're going into your weight room and you're lifting as heavy as you can with a deadlift and a front squat. Yeah. And what time are you spending?
Stretching is boring.
Yeah.
Why would you do it? So we had Alyssa, my girlfriend's a dancer, and like that's super true what you just said. The first time we went and did yoga together, I'm like sweating trying to touch my toes, and she's in a full splits, like doing these weird, stupid things.
Right.
That's awesome.
And so, like you guys said, when it comes to something like as simple as a deadlift, that's our fault. If you didn't continue to do it, there's acute lower back pain syndromes that maybe prevent you from doing that at first, but the proper rehabilitation, you should be able to get there.
That's right.
If you can't, there's a test. I think I saw you guys have like Kelly Starrett's posters over there.
Yep.
If you can't sit in a squat for 2 minutes without like excruciating pain, you do something.
There's a problem.
Yeah.
And you can get there. You just have to work on it.
Yeah.
You can't do that once a year and expect it to be, thumbs up, all good.
Yeah. There's got to be more work put into it.
Yeah. Yeah. And the easiest, and I know CJ's got a couple more questions, but for me, what sticks in my mind most recently because of my shoulder surgery, I'm hypermobile. So my left arm is hypermobile, and I've always had really good mobility. And Maria's saying, hey, you're at the mobile range now. You're at where most people are. Yeah. I can physically get my arm up pretty high. She can take it and move it further. There's nothing, I'm recovering from surgery. Right. I don't have the ability the strength to move it there because I stopped moving. I was forced to, right? I had to have it in a sling for, 6 or 8 weeks, whatever it was, right? So I've got the range of motion because she can manually manipulate my shoulder to get full range of motion. Yeah. But I don't have the strength to get it there. And it talks to your point of, once you stop using that ability, you lose it.
And a lot of that, what we're seeing in the research is more maybe neurological than anything else. So the difference between passive and active ranges of motion,
perfect topic.
That has to go into, how we're training. So, and you guys can speak to a little bit more on how you take people from couch to CrossFit, because that's, I think, the biggest part of what we may be talking about here. Yep. But if I have an athlete that comes in and they have anterior shoulder pain, trying to figure out, diagnose what it is, and their active range of motion is 170 degrees of flexion in the shoulder, where it should be 180, unless there's something else going on in there. But he still wants to shoulder press and lifting 3 times a week.
Yeah.
I'm like, if you don't have the prerequisite of joint range of motion, so if you don't have the ability to achieve that range of motion actively yourself, then why would you ever expect to put a 55 or plus dumbbell in your hand and repetitively load that motion without somehow screwing up the shoulder? Yeah. And so I think that's the biggest error at the onset of most training programs is we're expecting ourselves, or us as coaches are expecting others to conform to these movements that maybe they don't have the right prerequisites of joint health beforehand. And so that's where somebody like a manual therapist comes in, or that's where coaches come in to pick those things out and say, hey, maybe not that right now. Right. Let's modify this and try to build that articulate range.
Yeah. That's a big thing we always talk about too, is like in our intro classes, we always make sure we bring it up, like your range of motion, being able to do a movement is much more important than actually doing the movement.
Absolutely.
So
I found that out the hard way myself. I lifted heavy through college playing sports and hurt my back the first time playing football in college. And, you recover quicker back then. So, I'm back to lifting in a couple weeks. But, when I wanted to still be active into my mid-20s and then late 20s, I'm like, man, that doesn't feel right. I'm not as low in a squat. I can't deadlift anymore without screwing up my back somehow, without feeling like, like something's happening for 2-3 weeks. Yeah. And so, I actually now have cut back on most of my, hard weight training and done mobility. Like I spend like 14 hours a week just doing range of motion, mobility work.
Yeah.
And so that works better for me. Not that I wouldn't want to get back into some of that stuff, but I think we have to be honest with ourselves in terms of our limitations and
Yep.
work on those
Yep.
before you maybe step it back up. Because I think that was the biggest issue for me, and it is for most athletes, is you want to be able to do something so badly, a certain motion or a certain lift.
Yeah.
And if you don't have that ability to get there safely with a clean motion, you know, then you're going to end up having issues down the line. It's a mathematical equation. If the load into a tissue exceeds the capacity of that tissue to bear that load, you're going to have tissue failure or injury or inflammation, whatever it ends up being.
Yeah, that's a big thing that ego gets in the way there a lot.
Every time.
Yeah, no question.
Yeah.
No question about it. One of the first intros into kind of the chiropractic realm for me was a mutual acquaintance, Dr. Ohm, in Columbus, who I met him through Olympic weightlifting clinic.
Right.
So our kids went to one of the Olympic trainers down there in Columbus, and he was there giving a clinic, and he was talking to some extremely, these are Olympians that he was working with, showing them how to brace and move properly. And I'm scratching my head going, he's a chiropractor. I don't get it, you know. And then the more I sat and listened, went, holy smokes. Yeah, there's a lot of what you just talked about, you know, having the ability to move in a range of motion before you throw a bunch of weight. And that's where he was, like his whole concentration was, let's show you how to move.
I've used a lot of Rich's stuff in my own. I think one of the reasons whatever we choose to do with our lives is we have an issue and we're trying, like I got into some of the mobility stuff because I was having issues myself and I'm trying to fix myself. So I'm taking seminars, you know, every once in a while I'll just say like, hey, can this work for me? Right. And so I've used Rich's stuff quite a bit in like pre-lifting and post-lifting type stuff, you know, just trying to engage core muscle, that type of stuff. It matters. It really does.
And I think that's where, at some point in time, that's where I want to gain. I want you to help us as a group teach us that, or whether that's a class-based system. That's kind of what I see us growing into. So not only are we, you know, having athletes that, hey, I've got a hip issue, I've got a back issue, hey, you need to go see Dr. Tyler and Sonny and team, and have them help you with that. But also in the future, hey, let's intertwine some of that. What can we do? What kind of classes can we have that helps people move better, like Dr. Ohm was doing with his Olympic lifting.
One of the more recent seminars that I attended was functional anatomy seminars, and they have basically a movement system, and one of their subsets of the system is functional range conditioning. So working on those ranges of motion. So that can be a class-based thing, but there's also like a kinesiology stretching or kinesia stretch type class, and basically it's not yoga, it's not Pilates, it's let's learn what our bodies have in terms of their limitations in certain ranges of motion, because we're all different.
Right.
Your shoulder flexion might not be mine, might not be yours, definitely isn't yours at this point, but it can get there. And so working through a class-based system or a one-on-one system, whatever it ends up being, through certain exercises or through certain positions and postural changes, achieve those prerequisites so that we can push and lift and pull like we want to.
Right. Yeah. And that's our goal, I think, is to work towards that communication and then offer those ability for athletes to come in and take that class or take those classes, or maybe it's a seminar based or, you know, something along those lines. And that's how we tie the community together. You know,
you guys have Maria doing something soon here with return to lifting for pregnant. That's a huge miss in the CrossFit coaching realm. Not on purpose, not nothing that the CrossFit team or CrossFit group hasn't been able to capitalize on, but from how do I take a individual that has either had a pregnancy or is pregnant today, and how do I bring them back? It's different than how CJ and I or you would work through the same, hey, here's how you set up for a back squat, and this is how you hold and breathe.
Bracing.
Don't do that. Don't do that
Right.
with a post,
Right.
somebody that just had a baby.
Thank God they have the kids, right? Like it's hard enough for us to figure out how to
Yeah.
squat again. Like,
Yeah.
Can you imagine?
Yeah. Yeah, exactly. Right.
I
And
had
we,
so many arguments with my wife about like we were going to name our first kid.
yeah,
And then you see like the process of
Yeah.
childbirth and you're like,
you name whatever you want. Hey, I'm good with it. Yeah.
good for the next however many years.
Yeah, that's right. Yeah.
Just
Yeah, there's
incredible.
no question. Yeah. So Maria's helped us out a ton there. And she's here in January, she's going to hold a seminar that works with those individuals that shows that process and how that works.
Yeah. Yeah, absolutely.
So that's kind of I think what we can develop
Oh, well, yeah. I
as
think
a group
we have to work
going forward. Yeah.
because even if it's just coach based or then you guys bringing that to everybody, every athlete that's in here.
Yeah.
I think that's huge.
Yep. Exactly. Hmm.
So, well, this is going back a little bit, but I had a question. Like,
Yeah.
a lot of people have told me that like bulging disc and stuff you just can't fix, or they always just say that surgery is the only option.
So-
what? Yeah. Go
ahead, sorry. Sorry.
Just what's your take on that, or what?
Not true. I think the research and the majority of the literature has supported that. So let's say I take an MRI of everyone in the country, the world, doesn't matter. 70% of us have disc changes, disc bulging in the lumbar spine or the cervical spine, sometimes in the thoracic spine. So it's normal aging of the spine. When it becomes symptomatic, like an acute disc protrusion, herniation, or extrusion, those all mean different things. But if it's accompanied by leg pain or arm pain or radiculopathy, and especially if those
What's
symptoms,
radiculopathy?
it's
Butchered
basically
that.
radiculopathy.
I'm not even gonna try.
Yeah, nerve root injury. So if a disc herniates, or if there's an osteoarthritic change, or there's unfortunately like a really significant spondylolisthesis in the spine, you'll get pressure or irritation, chemical inflammation around that nerve root. And so if that is significant enough, especially the mechanical pressure, the actual deformation of that nerve root, if that's significant enough, you're going to start seeing neurologic changes in the extremity. So if I have an acute L5S1, the lowest disc in the lumbar spine, disc herniation, and it's giving me a lot of posterior thigh pain down the right leg. So that's what we would typically term sciatica.
Right.
If we do a neurologic workup and that patient has any weakness in their ability to move the ankle, foot drop type scenario, then yes, you may be, if all conservative measures first fail, a surgical candidate. The issues unfortunately, with most of lumbar spine surgeries is, and we're jaded as chiropractors because we see this stuff afterwards.
Yeah.
Continued pain syndromes after lumbar spine fusions or laminectomies, whatever.
Like
it
it's
may
still
be.
not working or whatever. So then they
Right. And so one of the biggest issues is maybe there was a rush to surgery without trying certain conservative measures. So there's just like anything, and bringing our profession to some sort of standard of care, meeting that complementary medicine standard is we need to be better about our exams. We need to be better about education on these injuries, because there's a vast majority of those issues that can be fixed conservatively, or at least managed. Nothing ever is fixed. It's managed. Low back pain especially is manageable, not curable.
But that's your Cox technique, I think, was really good with that. Like,
Yeah, that's what it's geared
that's
towards.
right,
That's
because
what it's geared towards.
it was so like much more gentle and everything when I sat in and saw it than what I would have expected.
So if anybody listening or anybody's ever had, I personally have an L4-5 disc bulge, and I get some numbness down the left thigh, and that's gotten bad at some times, but with treatment and with modifying movement, it gets better, and it's very manageable, and I can kind of lift how I want now. If anybody's ever had acute lower back pain, especially if it's made its way into the leg, or acute neck pain and it's made its way into the arm, you've probably been treated by something like decompression techniques. And so those are more geared towards the health and the recovery of those disc tissues than something like a high velocity adjustment that traditional chiropractic technique involves. And so, like I said, more tools in the bag, you can fix more issues. But no, the majority of those things are treatable, especially if caught early enough.
Right.
But the second that there's neurologic changes, loss of sensation, reflex changes, something really nasty, not that we still don't treat those things conservatively, but we will refer on for a neurosurgical consultation. We will refer on for MRI.
Refer on, yeah. Okay.
Refer on, because they can be co-managed. That's, I think, the beauty of some of the techniques that we use in our office is we co-manage with a lot of neurosurgeons. And once they figure out that you're treating maybe in a conservative way, different way than what you think of when you think of a chiropractor, they're more apt to refer back to you and have those conversations conversations with you because, unfortunately for a long time, our profession was fringe, not necessarily incorporated into a lot of the medical community for good reason, for sure.
Yep.
So catching it early can save you a
That's
lot.
everything. Yeah.
Right.
Yeah. Catching anything early.
But that goes back to like why aren't we getting it all the time? Like, not all the time necessarily, but like you brush your teeth every day. Why don't you do this every day for your body? Or
and that's there's a physiotherapist out there, Greg Cook, who does FMS, functional movement systems, and you see that sometimes incorporated into CrossFit. It's basically a diagnostic process of seeing what movements you can and can't perform, you get a score.
Yeah.
But anyways, he's really, really hard pushing, if you go to your family physician for a physical every year, why aren't you going to some sort of manual therapist for a musculoskeletal exam?
Right.
How does your shoulder move? Does it move like a shoulder should?
Mm-hmm.
Or are you compensating for movement in other areas? Does your hip work like it should? And catching those things early and treating them manually, treating them conservatively, and having patients work on those things at home, you prevent the osteoarthritic change that's inevitable for all of us. Or if you have that osteoarthritic change, maybe you can tolerate it.
Right.
We take pictures of hips all the time that show severe osteoarthritis and the patient's got no pain.
Zero.
It doesn't. That's a whole different conversation about radiology. That we're finding out in the last however many decades that we don't get the information we want from a lot of those images. They're necessary in a lot of situations, but just because something's degenerative doesn't mean it doesn't move right.
Right. I took a note. I want to make sure after we get finished up, as one of our follow-ups to that, I want to review the ability to go through an evaluation with an athlete. I think that's super important for us as we bring new athletes in. Yet we review how to move properly with them, but we don't necessarily give them an evaluation kind of pre and post. Here's how you move today, and here's, for our knowledge, here's what we really need to work with, or transfer them on. Hey, we're going to start this here, but you need to see Dr. Tyler because of what we see, in a squat or whatever it may be.
There's a lot of ways to go about that. A lot of movement systems have developed ways that they think is best to assess range of motion beforehand. In order to deadlift or squat heavy, you should be able to hold a plank for a certain amount of time.
Yeah.
You should be able to stand on one leg for a certain amount of time. You should be able to show that you can do kind of a bird dog position without core stability wise.
Yeah.
Those things are necessary.
Which makes a lot of sense, but how often do people actually do that before?
Right. Look at what happens in most high school settings. In the last 30 years, probably more, Olympic style weightlifting has been introduced into high school athletics, no matter what sport you play. Okay. And the number of injuries we're seeing from those types of situations is terrible. Pars fractures.
Skyrocketing.
Yeah, exactly. And so, if you have 35 to 45 kids in a gym and one or two coaches that are trying their best to coach these kids through lifts, but it's a cookie cutter model of every kid's going to deadlift today. Yeah. When anatomically some of them maybe shouldn't or should be modifying that movement a little bit. When you look at like some of the elite level power lifters, that's God-given talent.
Right.
A lot of times. When you look at like the medal winners, they're from a certain part of the world.
Yeah.
And anatomically they're given a certain depth of hip socket that allows them to look safer.
Yep.
Some genetic freaks overcome their inadequacies and we have medals all over the place. But generally, you have to have the anatomy to become that elite level type athlete.
Like your grandpa had to be a Viking or something.
Right. Yeah. Well, yeah. And we talked about that correlation. One of our coaches in here, Mike Wolf, who coaches our Olympic, or not our Olympic team, but our powerlifting team for the special needs team. Yeah. He is a world record holder, and he currently holds 2 records here in the United States for bench pressing. I talked about this yesterday with him. There is some just God-given genetics. Okay, he's got a huge barrel chest and short arm range, and he's like, I was giving that genetic ability. Yeah. So yeah, I had to train for it, but pressing 1,005 pounds off my chest, he could do that.
Right.
But again, most of us, somebody that's say 6'4" and has a longer reach, probably won't get there.
You ever box a guy with a longer reach than you?
Yeah.
You know what I mean?
Yeah, that's right. Yeah. So that talks to what your point.
You have anatomical differences. We're all individual that way. And so some of us can lift a certain way and some of us can't, but that doesn't mean can't make your way around those,
Yeah.
like I said, inadequacies.
Yeah.
Lift the way that you want. You might never be the elite Olympian snatch squatter.
Mhm.
You don't have that range of motion, but
Yeah.
who in the population is really looking to be that?
Yeah. The key you made, the takeaway, at least from my point, and we've tried to teach this. I used to coach football here in Salina and try to help with that program. We now have a coach that is an L1 certified coach that also is on the team as a coach, is to be able to work with high school coaches and say, listen, I know you think you've got it all, right? But you've never been trained. You've never been truly on functional movement. You really don't know how to make sure that knees go out and chest stays nice and high in a squat.
Like what cues to give and everything.
That's
like
right.
that,
Let us help you. We don't want to take it over, but let us help you, show you proper technique, evaluate your athletes, set something up like you can go in and evaluate. Yeah.
Why shouldn't it happen? Happen through a sports physical.
Yeah.
You know what I mean?
Yeah, which is mandatory.
Yeah. So if you're going to put 350 pounds on your back, and then mom's going to bring you in with you crying because your back hurts.
That's right.
And they're wondering why.
That's right.
Yep.
Yeah, you should know how to train and know how to spot. You shouldn't put 350 pounds on. Matter of fact, let's not put a barbell on your back at all right now.
Yeah. Start with a PVC pipe or a dowel.
Yes.
Make sure you can do it correctly.
Yes. Yeah. Cool.
Yeah.
What other questions did you have there?
Well,
Give me some
I
good
think
ones.
We kind of give you some good.
Give me
I
some
got
of those.
Good ones.
Yeah.
Just wait.
Don't go there.
Yeah. I have one that throws back to cracking the knuckles.
Yes.
And this is more of I've always wanted to know because I grew up, my grandparents raised partially by my grandparents.
Mm-hmm.
And I was that kid that sat there, nervous habit, and I'd crack my knuckles.
Yeah.
And my grandma would say, you never do that. Your knuckles will fuse together.
Yeah.
And I'm like, Grandma, they will not. So.
That's the question. Yeah, absolutely not. So actually, that's funny that you brought that up because I just saw the research. Again, they did like a study, and there's no correlation to people that do that to osteoarthritic changes in the hands.
Because so I heard arthritis. If you crack your knuckles, you get arthritis.
Not necessarily.
So
in fact,
cool.
I think in the study they said that it actually improves range of motion.
Yeah,
that's taking 40 people and studying them. You know what I mean?
Yeah,
30 knuckle crackers and 10 knuckle crackers. How accurate it could be, but I'm unaware of any negative effect to that. That's not to say that there's
Matt, you're safe.
right. Yeah, you're safe. That's not to say that there's not drawbacks or dangers to high velocity adjustments to other areas of the body on a repetitive basis.
Yeah,
but no, you don't have to worry about that.
What about manually cracking your own neck? You know how you kind of like you get a little tight spot and you're like, oh, let me see if I can get that.
So I don't necessarily think that there's anything wrong with doing that because it ends up being similar to cracking your knuckles. But what ends up being maybe sometimes dangerous, and in my short career, I've seen the kids that come in and they can't move their neck because they do that on a regular basis. Forcefully moving that movement. Forcefully bringing yourself to end range and trying to see those people that really crank it. One of the issues with chiropractic care, at least in our relationship to the medical community, was and still is sometimes maybe unwarrantedly was the risk of stroke vascular incident with a high velocity cervical spine manipulation. That's because the anatomy of where that vertebral artery sits in the foramen, as it heads up to the brain, supplies the brainstem. And so it's not the movie where, the guy, and you kill. I mean, there's not a huge danger to doing that as long as it's not like all day, every day. Forceful.
Right. Forcefully. Is there also a risk for blood vessel rupture? Is that something?
So what the research has actually supported is that you're just as likely to leave your family doctor's office and have a vascular incident as you are a chiropractor's office.
Yeah.
Unfortunately, yes, there are incidents of post-chiropractic manipulation of the cervical spine, stroke, those types of things happen. But what I think has been shown is that there was already the process of that desiccation of the vertebral artery before the adjustment. And that's why those things can be so dangerous. Yeah. And that's why in some situations our profession has gotten that mark against us, warranted mark against us. Because if And unfortunately, the orthopedic tests to screen those things out aren't great either. We have VBAI tests to see if a patient is already suffering from something like vascular insufficiency, and not super accurate. And so we in our office, like I discussed with you and CJ, you saw, we try to stay away from those adjustments just because of the safety aspect of it. That's not to say that they aren't efficient, that they aren't beneficial, because there's whole subsets of the chiropractic profession that just adjust the cervical spine. Upper cervical chiropractic is in a lot of ways thriving because it does seem to help patients. But there's an inherent risk. There's an inherent risk in everything.
Yeah. And that's why I ask all of those lead-in questions. And you have to, you spend, people like, oh, I got to spend time writing on all those papers that you get when you go
like
to his office the first time. Because of the unknown pre-existing that you have to be so concerned with.
Right.
It's no different than somebody coming in here.
Right.
If you have a pre-existing injury, shoulder, knee, hip, and you start CrossFit, it's not that pre-existing injury happens suddenly. This movement style will pinpoint that right away because of the range of motions that we want you to try to get through. So if you've got a pre-existing shoulder, you got a labrum tear, you're going to know it really quickly. And people are like, oh, I did that because I started CrossFitting. No, you probably had that pre-existing issue. And then once you start asking them, well, yeah, I did do something to my shoulder a couple of years ago and you never got it fixed. Well, no. Okay, so let's fix that first. That's right. Let's fix that first.
And that's why it's important for what you guys do here in terms of taking it a bit further than, hey, this is a gym. I come in, I get my workout done, and I leave.
Yeah.
You guys do quite a bit more than that.
We try to. Yeah.
I think that speaks a lot to you as well, though, because you do the same thing, right? You're like,
we try.
You try, but then you refer on, so you're not.
Well, I think,
right.
Like I said, bringing chiropractic to the mainstream a little bit in the last 20, 30 years. I think we have to be able to be part of the medical community in some way, shape, or form. And that has to be built through trust and knowing that, hey, family physician down the road understands that if I know I shouldn't be treating something, I'll refer on. And most chiropractic institutions, if not all of them, do train us somewhat in the first year and a half to be primary care physicians. So I know how to do a cardiovascular exam.
Right.
I'm not great at detecting a really slight murmur, but how many people have come into my office with kidney stones that look like back pain, or acid reflux that looks like mid back pain, or we've seen heart attacks. Yeah, office. You got to get them. You got to get them help.
Yeah.
And so appendicitis refers to certain areas, mostly lower quadrant. But we see that's the exciting part about practice, at least in this area. I think is people around here go to the chiropractor first.
Yeah.
And so, it's some days are crazy, but they're super interesting. Yeah. You got to be on your toes.
Yeah. You were telling me when I was shadowing that like the first year and a half is literally med school. Maybe
to a certain extent. Yeah. I think we get, I don't want to overstep my, no, it's pretty intensive for the first year and a half. And then we branch off and do our clinical medicine, things like that. But the doctor that taught us neurophysiology and neuroanatomy wrote the textbook that medical students use. So it's not some fringe medicine, I think, that we have an unfortunate reputation of being.
Right.
A lot of us try to do the best we can and do right by patients and not, overstate what we can and can't do as chiropractors.
I think we see that a lot in CrossFit too, is like CrossFit can have a bad rep, like your back squatting, your deadlifting, everything that's bad for you.
Oh, in all honesty, especially in my line of work,
right?
And physical therapists, like who hurt their back doing CrossFit today?
That's right.
You know what I mean? And so, like you guys do, and I don't know if you wanted to speak on that or not, but the couch CrossFit stuff, like that matters. If you
matters.
Can't do that right now, then don't, and we'll build up to it.
Yeah, and that's when we have our first intro in the couch CrossFit. The very first day, we have it literally is just a sit down meeting, and I use an example. I put a marker on the floor, and I asked one of them to pick it up, and they pick it up, and I said, "Thank you. You've just deadlifted that." And they kind of looked at me puzzled, and I said, we're going to show you how to do that properly. But tomorrow when we start, that may be the only thing that day that we ask you to do, because that's all you're capable of doing right now. Tomorrow, we're going to ask you to do that maybe twice. You know what I mean?
Just
Because
what it has to be.
we've got to build that ability to move. Cool. I have one last question. I don't know if CJ's got a couple more, and it's really not a question. It's more of a statement. One of the cool things that I found just going to your office and how you kind of worked with Maria and through what you worked with me on was the last statement. I looked at you and said, well, when do I come back? And he's like, you only call me when you need me.
Yeah.
Right. It's not like, hey, I need you to see you 4 more times and I'm going to bill you, because in the back of my mind, it's like, okay, he wants to see me 4 times and there's another $75 times 4. And it was, no. Listen, I think you're good. If you have an issue, then you call me.
I think, like I've maybe mentioned a time or two already, I think our profession gets a bad reputation that way, and for good reason. There's, just like anything, there's good and bad that follows a certain type of medicine. But the goal of any complementary medicine would be to treat you as little as possible.
Yeah.
Send you on your way feeling pretty good with the understanding of what your condition may or may not be.
Yes.
And how to treat it maybe for yourself at home.
Yep.
And that's why, unfortunately, and we talked about this, there's a lot of different ways to do chiropractic care. A patient with lower back pain can go into 2 different offices, get 2 very different treatments for the same condition, be told a very different diagnosis of the same condition, and come away with a different education of what that injury means. Mm-hmm. So if a patient comes into my office and we can diagnose with a disc herniation and make a patient understand that, yes, there's going to be some follow-up involved, but just because we're using a term like disc herniation doesn't mean that you're going to be here for as long as possible.
Right.
That it means that you maybe need to have surgery. You try to educate best you can based on your own knowledge.
Yeah.
But also to say, at some point, we're going to discharge you with the ability to treat yourself.
Yeah.
And so I think that's important. No one wants to come into an office and be like, all right, I'm here for how long?
Right.
You know what I mean?
Yeah.
So we try to do our best that way.
Yeah, creating that autonomy is very important, I think. Mm-hmm. But that kind of leads me into the question too, like what should people look for in choosing a chiropractor? Like if
that's a good question. I think anybody who's continuing their education, first and foremost, we try to do that as much as possible. And we take that, cue from my father-in-law. The guy's going to be 60 this year, and he's got his nose in a spine journal every day. I think you can tell a lot about each of us in the office based on what's on our desk. Mm-hmm. And he's thumbing through spine journals every single day, the day that they're coming out.
Yeah.
My wife, Sunny, who's a certified medical acupuncturist, she really enjoys using that in her everyday practice. Yep. She's huge into maternal health and pediatrics. That's just the time in her life that she's in. Sure. She really likes treating those things. And then if you look at my desk, you may have seen I've got like functional rehabilitation textbooks. Mm-hmm. So people that are maybe continuing on with their education, because you don't learn enough in any school.
Right.
I learned more working for my father-in-law and just watching him do what he does in the first year than I did in 4 years in chiropractic school.
Yeah.
So somebody that's staying up, that's completing their continuing education, somebody that has kept up with the research and understands what these conditions are, and maybe doesn't overstate what a chiropractor can and can't do, and somebody that has a reputation for involving family physician, or has a relationship with other doctors.
Yeah. Well, kind of like Maria. Yeah. Like there's some areas where like, hey, you need a physical therapist.
Yeah. I've referred a few patients of my own to Maria for pelvic floor dysfunction.
Yeah.
You have to have those resources because you can't treat everything. You're not going to fix everything.
That's right.
That was the hardest thing for me initially, was saying, no, I can't fix everything.
Yeah. And the cool thing I think about all of this, and hopefully as we wind down here, we can introduce you to Dr. Wilson, Dr. Libby Wilson, because at some point in time, I think there's that functional medicine need. That when you see one of your patients, you're going to recognize that there's a lot going on here.
That's like every one of my patients.
That's right. That's right.
That's all of us.
And what you need is more dedicated long-term care. I'm going to help you with this area, and a functional medicine doctor is going to help you with this, and I think that's the cool thing about where the industry is going, where the medical industry, your field, Maria's, Dr. Wilson's, where that's headed in the future.
It has to, because look how it's failed us in the last 50
years. Yep. Insurance rates have gone up, and costs have gone up, and
we spend billions of dollars just on lower back spine pain disorders every year.
Right.
We don't have any better care than we used to.
Yeah.
We don't have any better understanding of what it is and how to treat. We just don't.
We've got a new medication. Try it.
Right. The longevity, like I talked about with the evolutionary basis of health.
Yeah.
we've expanded our longevity. We're living longer, but
Yeah.
our golden years so golden. You know what I mean?
Mhm.
So
Yeah.
we can take all these medications to
Yep.
mask things.
Yeah.
But
Yep.
I'd love to be able to do little things like climb stairs, maybe go for a long walk when I'm 75, 80.
That's
I'll
right.
Make it that long.
Yep. I've got a saying, 108, feeling great, and I want to still be CrossFitting.
Absolutely.
That's my goal.
Absolutely.
Cool. All right, so a few questions to wrap it up, I guess. What's a few things that you do every day that positively impact your life?
That's a broad question there, CJ.
Give a broad answer.
Yeah, I will try. So going along with some of the certifications that I have, the FRC, the Functional Anatomy Seminar stuff, one of the aspects, one of the staples of the system is doing something for your joints every single day. So controlled articular rotations. So I have a routine that I do, as stupid as it may look, to move every joint possible in my body every morning, and I sometimes do it at night, especially if there's pain involved in those. So movement, just like brushing teeth, we talked about. Try to, best I can. I was a couple years back really into meditation, so I did that every chance I got. More kids, good luck, but try to take some time to just not look at a cell phone or a screen and take a few deep breaths. That's important. And then all of these are health answers, sorry.
No, that's perfect.
No,
that's
yeah.
what we.
Yeah.
Yeah, and it just had to be one.
we
It's
have
all
it
good.
right.
Yeah.
Eat as well as clean as you can. There's a lot of different diets out there. I started doing some intermittent fat or time restricted eating
Yep.
a while back, and it seems to have done well for me. So just knowing what I'm putting in my body and moving as much as possible.
Nice. Yeah. That was a great answer for a broad
You're
question.
welcome.
Yeah.
What's ready for a broader question?
Yeah. Yeah.
What's something you know you should do to positively impact your health, but you don't?
Well, I should probably do some more cardio work. I'm a slacker in that regard. I married like a high caliber endurance athlete.
Yeah.
And
She
that
ran
just
for Notre Dame.
Yeah. I mean, come on. Let's be
She's got a
honest.
couple state championships, I think.
Yeah.
Yeah, that didn't transfer to me. In fact, when we started dating, I lied to her and I told her I was a runner. Like I had like a background in it. And so for like the first month of dating, I would come up with every excuse under the sun to say why I couldn't run with her. You want to go for a, you want to? So my punishment actually, once she found out and I had to fess up to it, 'cause your dog can get sick only so many times,
Yeah.
was the Chicago Marathon.
Oh,
And that was
Oh.
like a couple weeks before we got married. Yeah.
Nice.
And so, yeah, she made me train for that and run that, and it was miserable. So ever since
Note
that
to
was
self.
the year we got married, yeah. And so ever since 2013, I have not put
Yeah, I
in
don't know
more
why you
than
don't
5
like
miles
running
at a
anymore.
time. Yeah, no,
Yeah.
that was more than I thought I should be doing.
That's crazy.
So I should be, yeah,
Yeah.
more cardio.
We have this thing called CrossFit over here.
Yeah.
Got some
So I'll
cardio
have
to
Look at that. Yeah. I'm like the only one you guys have had on here that's not like in the gym here every single time.
That's not true.
No.
Oh, good. I
Who?
feel so terrible.
Magistrate.
Oh yeah, Magistrate Donna.
Yeah.
Donna Post. There's still time.
You're good.
You're good.
Just
Intimidating.
Yeah.
Yeah.
I've done a few CrossFit workouts, and you figure out very quickly your inadequacies.
Yeah.
You're
Yeah.
going through
Yeah.
those workouts.
Yeah.
Very, very humbling.
Yeah.
Very humbling
For
experience.
sure.
All right. What's some advice you'd give to someone who wants to or is thinking about chiropractic?
So the conversation we had like 2 weeks ago.
Yeah.
Generally, that's a really good question. Look for something in an institution like we talked about that is more evidence-based practice. Look for students that are already there that enjoy the process of it, because it's it's not medical school, but it's rigorous. I thought I was a decent student through high school and through college. That stuff came easy to me, and then you get into chiropractic school and you're like, nope, can't skate. No, you have to study almost every night. And
Yeah.
board exams are a bear and everything that way. So
Yeah.
that's a tough question to answer, but I think you'll know, like we talked about before we started this, everybody's still trying to figure out what they want to do with their lives.
That's right.
Right?
Yeah.
Like, as soon as you figure that out,
45
tell
and
me.
trying to
Yeah,
figure it out.
Exactly.
Yeah.
And so don't be intimidated by the cost of it. I guess, because if you're in it and you know that you love it, you'll make it work somehow.
Mhm.
Right.
So,
Yeah.
hopefully that answers some of your question.
Yeah, for sure. Thanks. Last question. If you could fight one horse-sized duck or 100 duck-sized horses, what do you choose?
Horse-sized duck or 100 duck-sized horses?
Yeah, I gave you a good clue to this before the podcast.
Oh,
Well-
chicken power versus horsepower?
Chicken power? Yeah.
Yeah, so I would rather fight horse-sized ducks. Horse-sized ducks is what you're saying?
Yeah.
Horse?
One horse-sized
horse-sized duck
Or 100 duck-sized horses.
horses bite, right?
Yeah.
Pretty
Ducks
hard.
do too.
Yeah, but ducks can fly. I'm going with the 100 duck-sized horses.
Really?
Do I get a weapon?
You walked in the garage, found a baseball bat.
Oh, duck-sized horses.
Duck-sized horses.
Yeah.
He's siding with you.
Dr. Libby would disagree with you.
Yeah.
So you don't
Horse-sized
have your
duck?
life together yet.
I would do one horse-sized duck.
Yeah, you
I
only gotta
wouldn't
kill
do
one
that.
thing.
No way. Climb a tree and start whacking.
Yeah. Now, you don't know what a horse-sized duck.
So I don't think there's a right answer or a wrong answer to this.
I think of the strength of an ant. Like, does that how strong
Right.
are
See,
ducks?
Oh.
there's a lot
For their
that goes
size.
into it.
It's true.
Are the horse-sized ducks still as strong as a normal horse?
See,
a lot of
there's
duck
no
power.
It's a lot of duck power. 45 duck power equals 1 horsepower.
Really?
Chicken power.
Wow.
Chicken power. Why are you wrapped around chickens?
You said chickens.
I might have said chickens.
You did say chickens.
I said
Was it
chickens.
ducks?
It was ducks. I said chickens in the thing?
No, earlier today,
Oh.
before we
Making me
started.
think that like 45 chickens have the.
Well, how strong is a
equivalent of
chicken
one
compared to a duck?
I have no idea. I want you to research that.
Okay, I'll do that.
Right on. Well, Dr. Tyler, thank you.
Thank you guys for having me.
This is one I hope of multiple. I want to dive into the next one. I want to dive into more kind of the next step of what you feel could work for an organization like what we have here. And
Definitely.
I'd love to
Try to
invite
get
you.
something started.
Yeah.
That's right down my alley of stuff I want to start doing.
Exactly.
Yeah.
So we'll break that down into the next podcast.
Cool.
Awesome.
We want to thank Dave.
Yeah,
Kiddo,
Dave.
too.
These are
Thanks, Dave.
Yeah, still unsponsored, Dave, but thank him anyway.
But we still love him and his drink.
That's right. It's
good
like
stuff.
drinking an IV.
Yeah.
That's
A
it.
A doctor of chiropractic likes it too.
That's right. Right
Got
on.
it all.
Well, thanks, man. Appreciate it.
Thanks a lot.
See ya.
appreciate it.
Nice work.
Word. Boom.